Hi, my name is Daryl Nydam, and I'm a veterinarian and epidemiologist in the College of Veterinary Medicine at Cornell. And for this transition cow segment, we're going to talk about dry cow therapy, particularly selective dry cow therapy. We're going to work a little bit through why and how this might work, and then end up talking a little bit about a program where the veterinarian of record for your farm can get some funds from the New York Farm Viability Institute to bring this practice to your farm. So why is selective dry cow therapy important now? Consumers are ever more eager for us in animal agriculture to be judicious about the antibiotics we use because it represents a choice they have in purchasing their food. Furthermore, there's legislation in other countries and some states which has forced all of this to happen. I believe in New York State, we can be leaders in this and get out in front of any proposed legislation and keep these decisions on the farm. A very practical matter is that some dry cow tubes right now are on back order, and we need a realistic option for product allocation within the herd. In the long term, the real driver here, though, is that we can reduce antibiotic use on the farms, saving up to 55% in antibiotic prevention and control costs without decreasing herd health or cow performance. And we'll work through some of the science now that we've done to show this. So we're going to start with where we came from in blanket dry cow therapy, and then work through some options for selective dry cow therapy. Back in the late 1960s and early 70s, we advocated blanket dry cow therapy. That is treating all 4 quarters of all cows at the beginning of the dry period. And we did this to treat existing subclinical infections and to control potential new infections. And when we started this, and it got codified into the 5-point plan for mastitis control and then the NMC's 10-point plan, this blanket dry cow therapy was the right thing to do back then, because at that time, the average dry cow was likely to be infected or acquire a new infection at the beginning or through the dry period. And also, we had a very high prevalence of contagious pathogens like strep ag, which is very treatable infection. And blanket dry cow therapy helped us to reduce strep ag to the point where it's a pretty uncommon occurrence now. Furthermore, there was a higher prevalence of Staph aureus infections back then as well, and now many dairies can control Staph aureus to the point where we can live with it. As recently as 1985, when studies looked at the percent of quarters that were negative, it was only about 45% of quarters that had no bacteria growing in them. Studies we've done in the last few years, though, have shown that 75 to 90% of quarters are now negative. So we've gone from a place where the average cow likely had a quarter with bacteria in it to now a place where it's actually the rare cow that has a quarter infected at the dry period. And through lots of management factors, you can see that since the 1990s up until currently 2020, the herd level bulk tank somatic cell has gone from over 300,000 to less than 200,000. We should congratulate ourselves for this continuous improvement in udder health throughout the years in the dairy industry. Also, when blanket dry cow therapy was introduced, we didn't have the availability of teat sealants. And now we have both external and internal teat sealants, both of which can reduce new IMIs, that is intermammary infections, and reduce clinical mastitis in the next lactation. If I had my choice, I'd use an internal teat sealant. They're very effective, but in some markets, external teat sealants are better than using nothing. And we have these tools now. So with ever improving udder health, changes in udder health pathogen ecology, i.e. removing many of those contagious pathogens, and tools now like teat sealants, I think our industry is ready to look at selective dry cow therapy in the right herds. And that is identifying and treating only those cows or perhaps quarters that currently have or are at risk for infections, as opposed to blanket therapy where we treated every quarter of every cow. To do this, we need to ID which cows or quarters to treat. And to do that, we have to use tools which are accurate enough to separate those cows into high and low risk cows. They need to be quick enough because we don't have a lot of extra time to diddle around on dairies, and it needs to be inexpensive enough that it doesn't cost more than the money we're saving on antibiotic tubes. So we'll look at some tools that we've developed. One day, some of the authors here, Paul Verkler and I in particular, were out on one of our client dairy farms, and they asked us, hey, can you build an algorithm which will help us identify and not treat low-risk cows? Because they had really good udder health procedures and really good udder health. And they wanted to know if we didn't put antibiotics in, would those cows experience negative outcomes? And this became part of the heart and soul of Dr. Amy Vasquez's PhD. So here's a picture of the farm that we first tested this on, a New York State dairy milking about 1,800 cows. They were on DHI test and they dried off cows once a week. And we designed a randomized controlled trial to figure out if this would work. So we built an algorithm, which I will detail for you a little bit later. And what that algorithm that's in the computer, and now it's in DairyComp also, you run that algorithm and it sorts those cows into low-risk cows, those cows which are unlikely to have an intermammary infection, or the high-risk cows, which are more likely to have an intermammary infection at dry off. And those high-risk cows, we still treated them with intermammary antibiotics, and they also got a teat sealant. The low-risk cows, those that were unlikely to have an infection, we randomized those cows to get only a teat sealant or a teat sealant plus intermammary antibiotics in all 4 quarters. And at the end of the study, we figured out that 64% of the cows would be low risk. So about 2/3 of the cows unlikely to have an infection. And we randomized those cows to get a teat sealant only or to look and see if the antibiotics helped them. So what did we find there? So at this dairy, they had individual daily milk weights. So we looked at milk production, the big bioeconomic driver of decisions on a dairy. And we looked at the milk yield between those cows that got antibiotics and teat sealant. That's the group in the dark line, ABXTS, versus those cows that only got teat sealant, that'd be the red dashes. And you can see there was no appreciable difference in daily milk yield between those two groups. In fact, the little red dashes are on top of the little black dashes all the way out to the first month in milk. We also didn't detect any meaningful differences between culling or clinical mastitis in the subsequent lactation. And you can see here the ABXTS group, that's the antibiotics plus teat sealant group among those low-risk cows, actually had a few more died or culled or clinical mastitis up to 30 days in milk versus those cows that only got teat sealant. But those differences were not statistically significant. And there was no rhyme or reason to the pathogens left behind there. So armed with this data from a well-controlled New York study, we got together with our colleagues at the University of Minnesota, and we're lucky enough to get some big funding from the USDA. And we set out to get some collaborators in California and other Midwest states like Iowa. And we enrolled cows across the country in a randomized fashion in New York, Wisconsin, Minnesota, Iowa, California. And we did this study all through the summer of 2018, where we enrolled over 1,000 cows into 3 groups: those that got blanket therapy, those that got a antibiotic and teat sealant in all 4 quarters, and then we used culture to decide between low risk and high risk cows, and then an algorithm to decide between low risk and high risk cows. So here's what this looked like in a picture. Those cows were randomly assigned to get blanket, where all quarters got an internal teat sealant and antibiotics 2 days or so before dry off. In the culture group, those cows were swabbed onto the Minnesota Easy Forecast plate, and any quarter that had bacterial growth got an internal teat sealant and antibiotics, and those quarters that had negative growth only got an internal teat sealant. And then we used an algorithm that was in the on-farm computers to sort cows into high-risk and low-risk cows. And high-risk cows were those that had any somatic cell count on test day above 200,000, clinical mastitis within 2 to 3 weeks before lactation, and 2 or more clinical events. If any cow met any of those criteria, a high test day somatic cell count, clinical mastitis, close to dry off, or 2 or more clinical events throughout the whole lactation, they got antibiotics plus an internal teat sealant. If a cow met none of those criteria, the algorithm showed that she always had low test day somatic cell count and no more than 1 clinical event that was not near dry off. She only got internal teat sealant. And we followed these cows up to 120 days in milk. So what did we find there? Well, we had really good compliance in the antibiotic group that was blanket. 100% of the quarters got antibiotics. In the culture and algorithm group, antibiotic use was reduced by 55%. That means we only treated 45% of the quarters and thus cows in the culture and algorithm group. So the remaining question is, well, if we don't put antibiotics in those low-risk cows, what happens to them? Well, we found out that the cure risk across the dry period, that is cows that had an existing intramammary infection at dry off, did that cure in the subsequent lactation? And you can see the cure risk was the same, whether they got blanket dry cow therapy, culture-guided dry cow therapy, or algorithm-selective dry cow therapy. In fact, numerically, slightly higher when we didn't give them all antibiotics. How about acquiring a new intramammary infection? That means they didn't have an infection at dry off, but in the subsequent lactation, they did get a new intramammary infection. And you can see here, again, no appreciable differences. They were all about 15%. And the prevalence of intramammary infections post-calving, again, all about the same. And in fact, certainly not higher in the selective dry cow therapy groups. So those are some bacteriological outcomes. Those are fun to think about. But how about clinical mastitis? Those cows that might have to be treated again or go into the hospital pen? Well, we can see those 3 lines are almost on top of each other out to 120 days in milk. 14% of the blanket dry cow therapy cows had a clinical mastitis event, whereas only about 12% of the culture and algorithm cows did. So certainly not more, probably less. How about those cows that were culled or died out to 120 days in milk? Again, only using antibiotics in the low-risk cows didn't increase culling and death. In fact, the blanket dry cow therapy cows got a little bit more culling and death. How about somatic cell count and milk yield? Again, you can see those 3 lines, the red line from the blanket dry cow therapy, the selective culture-based dry cow therapy, or the algorithm-guided selective dry cow therapy. Those 3 lines all on top of each other and numerically just about the same. As in the New York only study, we found that milk yield was pretty similar between all 3 groups as well. So in summary, a nationwide study showed that we can reduce antibiotic dry cow therapy by over half without harming bacteriologic outcomes or bioeconomic outcomes like clinical mastitis, somatic cell counts, milk yield, and culling. So what does this cost a dairy, or are there even benefits to it? So the same team, led by PhD student Sam Rowe, our colleague at University of Minnesota at the time, we got together and we put together a partial budget analysis to look at this. So we looked at the total cost of all 3 programs, blanket, culture, or algorithm-guided selective dry cow therapy, accounting for total antibiotic costs, total labor costs, equipment costs if you're going to set up an on-farm lab. If you used culture-guided selective dry cow therapy compared to blanket dry cow therapy, we see here that the average or the mean upside is about $2 per cow better than blanket dry cow therapy. And this was a Monte Carlo model where we ran it 50,000 times to simulate what would happen for 50,000 years on a farm or on 50,000 different farms in 1 year. And 70% of the time, it was a net positive. We used the same Monte Carlo partial budget model, running 50,000 iterations, to look at the algorithm-guided selective dry cow therapy. And here, where test day somatic cell count was included as a sunk cost, i.e. you're already doing test day stuff, the mean herd increase in cash flow was $7.85. So per cow dried off, not just the selective cows, but across the herd, were upside $7 to $8 compared to blanket dry cow therapy. And in this model, all 50,000 iterations are above zero. So there's very little risk of having a negative economic impact to go to selective dry cow therapy. And if you want to play your own scenarios, you can Google or go to this website here. And with our colleagues, University of Minnesota, Sam Rowe and I, we put together this selective dry cow therapy cost calculator where you can put the number of cows to be dried off per year on your farm, whether you do DHI testing already or not, the cost of the dry cow tubes you use, do you use an internal teat sealant or not, the expected quarters to be treated or not, and the labor rate on your farm. And you can compare the cost of each dry cow therapy approach. And here you can see that in this default setting, blanket dry cow therapy is about $25 versus the algorithm, which is about $17. And then we're coming up with that $7 to $8 cost savings there. And the culture was about $22 to $23. So there we have our $2 to $3 savings, even if you want to do culture. For this to be successful, it's very important that this is done well and hygienically. A little quip here, what happens in the dry period doesn't always stay in the dry period. It's a highly susceptible time for cows to get a new infection, particularly during the first 3 weeks of the dry period, and then again immediately before calving. Sometimes this has to do with increased milk pressure, a little bit of leaking, if we don't dry off those cows well, and before the keratin plug forms in the teat to hold it out. However, we've developed these teat sealants to help us with biology and mimic that keratin teat plug. However, those must be applied correctly. You should do a good job, applying it if you're using an external teat sealant, or if you're using an internal teat sealant, make sure you pinch off at the base of the udder and don't squirt that teat sealant farther up there. And it's important to do this really, really hygienically. Our colleague, Paul Verkler, who's worked with us a lot on selective dry cow therapy, and our colleague, Heidi Sharkey-Webb, put this piece in Horde's Dairyman recently, and I think it's a good read. But some highlights are, when you're looking to implement transition cow, dry cow therapy, whether it be blanket or selective, you should ask, how are these cows sorted and held prior to dry off? Are they dried off after the last milking? And if so, sometimes you want to make sure that that deck of the parlor has not accumulated, in quotes, debris. Oftentimes at the end of a whole shift, we've accumulated a whole lot of stuff on that deck. We want to have this a clean environment when we're doing the dry off procedures. You got to be able to check IDs and work lists. Leg bands are a good thing to do. And when you're applying teat sealants and or antibiotics, teat end cleanliness is paramount. And try to work far to near. Those front teats first, clean those while coming backwards, and then applying antibiotics and teat sealants, work near to far. So then go hind to the fore teats. Is your farm ready for selective dry cow therapy? Here are some criteria that we think will lead to success. And one of them is a veterinarian of record that has a strong client-patient relationship to help get this going on the farm. The ability to implement new management tactics is important also, right? If you're shifting away from something you've been doing for a quarter century, like blanket dry cow therapy, you need to be able to do new stuff. You should also have the big rocks in udder health out of the way before you embark on this. That would be your bulk tank somatic cell count should be regularly less than 250,000 and perhaps even 200,000 to let you know that we don't have udder health challenges before you embark on this. Strep ag should not be present in your herd because it's very contagious and dry cow therapy is a good way to kill it. But most herds are fortunate around here to not have any strep ag, if any at all. Staph aureus should be controlled. Regular DHI testing can help both with the algorithm implementation as well as monitoring success of the program. Routine detection and recording of clinical mastitis is a good thing to do, no matter how you're doing dry cow therapy. But it's even more important if you're doing selective. Systematic dry off lists are good, and we've built some tools to help you in Dairy Comp 305 if you're a Dairy Comp herd. Monitoring of subclinical and clinical mastitis and or bulk tank culture surveillance to make sure that contagious pathogens don't creep in. These are all, again, things that you should be doing, whether you're doing blanket dry cow therapy or selective dry cow therapy, but become even more important when you're doing selective dry cow therapy. And if I haven't said it enough times, the data is pretty clear that teat sealant use at dry off, when administered diligently and cleanly, are an excellent tool to help us manage udder health. And as I mentioned, we've put this into dairy comp, where there's an algorithm in there to identify the low-risk cows versus the high-risk cows. And those low-risk cows can go on to no treat list, or the high-risk cows can go into a treat list. This is what it looks like on the screen in dairy comp. If you activate econ/SDCT, this will pop up where you can select with your udder health advisors the somatic cell point cut you want to use. And we recommend starting with 200,000. If you want to be more conservative and perhaps treat more cows, you can knock that down to 150,000. The number of test days to include in that, and if you leave it at 99, it's going to default to every test day in the lactating period, or you can choose 5, which would just be the 5 previous if you want to take away the first couple. The number of clinical events which you'll allow to sort cows into high risk and low risk cows, the default is 2. And if there's only one mastitis event, did it happen in the first 14 days or the first 30 days? And 30 days is the default. And this is what your dry cow list might look like. This particular dairy had 15 cows to dry off. They put in their do dry command, and in the column SDCTC, that stands for Selective Dry Cow Therapy Code, you see a bunch of N's and Y's. Those N's are for no, she's not a high-risk cow, so no, she's probably not going to need antibiotics, or yes, she is a high-risk cow, and yes, she might need antibiotics. And you can see out of this list of 15 that there are only 2 Y's in there. So there's a fair bit of labor, perhaps, and certainly dry cow antibiotic cost savings. And then we built in a bunch of monitoring tools in the Selective Dry Cow Therapy tab in the monitor guide. Okay, so type in guide in dairy comp, and you can look at a whole bunch of monitoring tools we put in there. And here's an example of one. So you can monitor chronic infections, new infections, and your cure risk after you've implemented selective dry cow therapy. And as I mentioned, we've been partnering with New York Farm Viability to make funds available to pay the veterinarian of record to get some help from our team members, Drs. Tracy Potter and Dr. Amber Forrestel. They can come out and work with your veterinarian of record to set this up in dairy comp or whatever other on-farm software you might have, and help build the right algorithm. You can use the default algorithm that's in dairy comp, or perhaps you have an automatic milking system, a robot, and we can work with you to build a judicious algorithm out of that as well. Or you could even set up on-farm culturing with them. But in there, there's $2,500 per farm for the vet of record to work and submit this to Farm Viability Institute for reimbursement. I look forward to the live Q&A coming up next, and we can have some discussion and answer more questions during that time. My email is here, and thanks very much for your attention. Daryl Nydam from Cornell. Thank you.